Welcome to SMA's Southern Medicine podcast. Practicing medicine in the southeastern United States presents unique challenges for healthcare professionals. The South's heavily rural population and limited resources require medical professionals to be more resourceful in their approach to providing quality care. SMA's Southern Medicine podcast addresses these issues by drawing on the experience of healthcare leaders who provide a multi-specialty, interdisciplinary team approach to medicine for the purpose of providing better care for the Southern patient population. Today we are joined by Mr. Matthew Dew and Dr. Richard Holt to discuss the association of intrinsic motivating factors and joy in practice, a topic addressed in an upcoming Southern Medical Journal article which was authored by Mr. Dew and Dr. Zhoy and John Yoon. Thank you both for being here today.
Thank you, Ms. Price, and Dr. Holt. Thank you for having me.
We're pleased to have you and excited to talk more about your publication.
Please tell us a little bit about yourself, Mr. Dew, your background and educational goals, as well as your professional trajectory.
Absolutely. Again, thank you just for having me and being able to speak on this publication that's coming out in the journal. And first, I just wanted to thank my co-authors, Dr. Jung and Dr. John Yoon, for their guidance on the work of this publication. So yeah, I just wanted to share a little bit about myself. I'm originally from Dallas, Texas, where I grew up, and went to undergrad at Princeton University, where I majored in molecular biology and minored in global health and health policy. I took one gap year between undergrad and medical school, where I interned at a federally qualified health center in the west side of Chicago called Lawndale Christian Health Center, where I learned the importance of urban healthcare, especially in an underserved setting, and also especially in a faith-based healthcare setting. So a very transformative experience for me in terms of my educational goals and where I want to be professionally later on. Right now, I'm at the University of Chicago, Pritzker School of Medicine for my medical education. I'm about to start third year, actually start my first rotation in a month, which I'm excited for. In terms of specialty interests, I've been asked many times before. I have many interests, but I would say where I could see myself right now is going into internal medicine. And in terms of research, I am primarily interested right now in exploring questions on what is physician well-being and how do we attain it, and what interventions can contribute to it. And the second question specifically also is what makes a good physician? So those are just some of my research interests so far, and I know we're going to be talking about a lot of that in this podcast. So I'm excited to talk more.
Well, thanks, Mr. Dew. We're excited to have you because you're looking at this through the perspective not only of your mentors, but also your own perspective as you face hopefully many, many years in a practice, helping people and hopefully bringing joy to you in your practice as well as joy to your patients. One of the things that seems to be a real interest, and I'm hoping that we do have some medical students, residents, and young physicians who listen to this podcast in the future, and that is finding a mentor in your growth and development as a physician. Residents are looking for mentors, of course, medical students are, and even young faculty members. And so that's an important thing. I believe those individuals would be interested in learning what is your perspective about a mentor, how you found Dr. Yoon and developed a mentoring relationship, and then how you became interested in this topic of the joy in practice.
Yeah, I guess I can tackle that second question first, on just how I got interested in joy in practice in the first place. I've always wanted to become a physician ever since I was in high school, and however, I was sometimes discouraged by how challenging of a profession it is, not just during medical school or residency training, but even during the practice after becoming an attending physician one day. And I've also heard stories of physicians who are burnt out and are just experiencing the stressors. And a lot of adversity in the practice too, while seeing suffering patients. But however, this concept of joy in practice intrigues me because it's given me hope that my future colleagues and I will not just be able to get by at work, but thrive and very much enjoy our time seeing patients, even 20 or 30 years outside of our training. Therefore, I've become interested in trying to understand what defines joy in practice and what contributes to one experiencing it. And just to also answer your question about how I got connected with Dr. Yoon and started working with him on this project. So actually it was during my gap year that I met Dr. Yoon. I was working at Lawndale Christian Health Center, the federally qualified health center on the west side of Chicago. And I was actually a tour guide there. And he is the director of an ethics and medicine program at the University of Chicago that educates both medical students and undergrads. And he was touring the health center with a bunch of medical students. And I was giving one of the tours, and that's how I met him. And afterward, he learned that I was accepted to the University of Chicago, and he invited me to join him and his group of medical students for dinner, where I got to learn more about him and his research. And what I learned is that he was just researching questions such as what makes a good physician, or how does a physician attain moral and social transformation in their training, and thus become a good physician. So I enjoy thinking about these questions because they go beyond the way that many physicians in hospitals are assessed usually today, from what my understanding, which is through a majority of quantitative measures and numbers. And I do appreciate thinking more about on the individual level, the patient and physician relationship, and how does a physician become a good physician. So after choosing to go to the University of Chicago for medical school, I definitely connected with him right away, and we got lunch together, and I just told him about my interest in doing research with him, and why I was interested in the types of questions he was asking. But at the time, I don't believe he had a project for me at the time, but 2 months later, reached out to me by email out of the blue and said that he found something, and he called it the Joy with Patients project. And I was automatically excited about what this would be. And I guess the rest is history. We've been working on the project ever since for my first and second years of medical school. So it's been a blast.
It's a great narrative. Thank you.
You have your study, The Association of Intrinsic Motivating Factors in Joy in Practice, a National Physician Survey, that will be published in an upcoming issue of the Southern Medical Journal. Can you summarize for our listeners the methodology, results, and conclusions from this study?
For sure. If I could just give some background before jumping into the study.
Absolutely.
Okay,
Absolutely.
Great, thank you. So physician well-being is an important subject, as we all know, which has implications not only for the health of our healthcare workforce, but also for the quality of patient care that's given. Also, as many of us know, the rates of physician burnout are high, and many efforts on an individual or institutional level have aimed to combat it. In 2017, the Joint Commission released a notable document called An Organizational Framework to Reduce Professional Burnout and Bring Back Joy in Practice. This paper defined joy in practice as the aspirational state in which professionals are emotionally and behaviorally compassionately engaged in the care of patients and the mission of their organization. Now, when one reviews the literature, to our knowledge, one will not find a study that utilizes a formalized joy in practice measure. Currently, most studies focus on one aspect of physician well-being, such as career satisfaction, resilience, or burnout. And some of these studies will actually consider this sufficient enough to measure joy in practice using just one of these components. However, in our opinion, this can be problematic, since the definition of joy in practice has many different facets that define it, such as exhibiting enthusiasm, fulfillment, or clinical stamina in your work. So to further illustrate this point, for example, a physician who is satisfied with their work may not exhibit fulfillment in their work at the same time. So yes, this is kind of the motive for our study. So recognizing the need for a more complete joy in practice measure, we set out to develop one of our own with 3 components that we selected based on its definition, which are enthusiasm, fulfillment, and clinical stamina. We also wanted to see which characteristics of physicians are associated with a higher likelihood of experiencing joy in practice. So that was our second aim. Now, jumping into the methodology of our paper, we surveyed a nationally representative cohort of 1,289 physicians from various specialties and practice settings. And we asked these physicians how often they look forward to seeing patients, which signifies enthusiasm, if they go home with the sense that they have done good and worthwhile work, which signifies fulfillment, and if they do, how often do they enjoy talking to patients after hours, which signifies clinical stamina. Physicians who expressed high enthusiasm, fulfillment, and clinical stamina were considered as experiencing joy in practice. We also asked questions concerning demographics about their practice and other measures of physician well-being, such as career satisfaction, and life meaning. So for our results, what we found is that our joy in practice measure was also associated with commonly used physician well-being measures in the literature, while it is negatively associated with burnout, meaning that our measure is at least in line with how we're measuring physician well-being today, and thus adds some credibility to our new measure. We also looked at both specific characteristics and factors of physicians that contribute to a higher likelihood of experiencing joy in practice. And we found that physicians who express that they have a strong sense of calling to the profession experienced a 10 times higher odds of experiencing joy in practice. Also, physicians who report having more than 7.5 personally rewarding hours per day were almost 4 times more likely to experience joy in practice. Meanwhile, we also looked at extrinsic motivators such as income, specialty, and practice setting, and found that these variables were not significantly associated with joy in practice. So our main conclusions were, first, that we developed a preliminary but promising joy in practice measure, which more accurately reflects its definition being comprised of enthusiasm, fulfillment, and clinical stamina. And secondly, intrinsic motivators, namely a strong sense of calling and personally rewarding hours per day, are strongly associated with joy in practice, unlike extrinsic motivators, which are not. Therefore, we conclude that intrinsic motivators should be further explored and should inform interventions because of their greater impact on physician well-being, specifically joy in practice.
We know that you specifically were looking at joy in practice, but you've identified both joy of medicine and joy in practice as important elements of our profession. How do they compare or differ? And can you just sort of define both of them with respect to your study and your understanding?
Sure. I think it's a very good question that sometimes or often needs clarification. So from my knowledge and review of the literature, these terms are actually used interchangeably often. Joy in practice is just a term that has become more formalized recently by multiple studies. And as I mentioned before, the Joint Commission has given it an official definition. So in summary, I believe they're referring to the same thing from my knowledge and from what I've read from many different studies that have talked about the different topics. But I believe it's important to mention that unlike other physician well-being measures, such as career satisfaction or burnout, joy in practice or medicine captures a more profound and holistic sense of well-being. And also, I believe it has more to do with the physician's calling, their purpose or mission in taking care of patients.
As you were conducting your study, did you identify any data that identified the impact of number of years in practice on joy in practice?
Yes, in fact, we did. We found that more than 30 practice years is significantly associated with higher enthusiasm and joy in practice. We believe this makes sense since physicians who choose to stay in practice longer must be enjoying their careers more and thus be experiencing joy in practice. We anticipate that many of these physicians who have chosen to stay in practice for more than 30 years have developed some number of long-term relationships with patients, which is considered an important facet of experiencing joy in practice, generally in the literature. We can easily see this being the experience of primary care physicians, which make up around 40% of our sample of physicians. Now, one might ask if we found an association between joy in practice and having long-term relationships with patients, and that the answer is that we did not find a significant association with our joy in practice measure. However, we did find that physicians who would say that they've been seeing most of their patients for a long time are experiencing high enthusiasm and fulfillment, which are important facets of our joy in practice measure. So essentially, long-term relationships seem to be an important contributor to experiencing joy in practice, even though it did not show a relationship with our preliminary measure of joy practice for this particular study.
I'm sure you came across this a lot when you were being interviewed for medical school. Obviously, the most common question is, why do you want to be a physician? Perhaps you'd share your own thoughts with us, but also whether this particular element or factor was found by your study to make any difference at all in joy in practice.
For sure. It's an interesting question. Again, that I've been asked a lot, many times before. So we didn't explore what the original reason was for why these physicians chose medicine as a career. However, one of the main themes of our study was to explore how physicians are motivated in their practice of medicine, and if those motivators are associated with joy in practice. Many studies have broken these motivators down between those that are intrinsic and extrinsic, which I've kind of mentioned before. Just to define them, extrinsic motivators include things like a physician's income or the type of work environment that they're in, including the number of work hours or the amount of physician autonomy that they have in the workplace. These have received more attention in the literature and have been found to be strongly linked with career satisfaction. As a result, they heavily guide the development of many interventions that have been implemented today to improve physician well-being. Intrinsic motivators, on the other hand, include things like altruism, intellectual challenge, or having a sense of calling to the profession, which I feel like are more aligned with how I would answer this kind of question, why I wanted to become a physician before going to medical school. Intrinsic motivators, on the other hand, have received less attention in the literature, and their impact on physician well-being is less known. One of few studies studying intrinsic motivators found that these types of motivators are more strongly associated with career satisfaction and life satisfaction than extrinsic motivators. And our study adds to this finding by concluding that intrinsic motivators, such as a strong sense of calling and having a higher number of rewarding hours per day, are strongly associated with joy in practice, while extrinsic motivators are not.
Why did you choose to explore and analyze joy in practice measures rather than the commonly utilized burnout element?
Yeah, absolutely. The way I distinguish between joy in practice and burnout as measures of physician well-being is to label them as a positive or a negative measure. Joy in practice being considered as a positive measure and burnout as a negative measure. So our vision for this study was to develop a measuring tool that would be able to assess for positive signs of well-being in physicians instead of negative signs such as burnout. I believe that the decision of what measuring tool you use for a study, whether it be a positive measure or a negative measure, kind of illustrates how you imagine physician well-being to look like. So for example, we pictured physician well-being as something as profound as experiencing joy in practice, as I mentioned, which captures a more profound concept of well-being. We wanted to avoid using burnout as our primary outcome for our study because we did not feel it was sufficient to equate physician well-being with a lack of burnout. In fact, we found that among physicians who did not report burnout in our cohort, only 21% were classified as experiencing joy in practice. Furthermore, another study in the past that I've read, which compared work engagement, which is another positive measure with burnout, found that among physicians who are experiencing burnout, highly engaged physicians were more satisfied with their career than non-engaged physicians, indicating that work engagement, a positive measure, is associated with physician well-being independent of burnout. Therefore, I don't think it's sufficient, in my opinion, to utilize burnout as a measure of physician well-being. And I think it would be better to use positive measures like joy in practice when discussing and discovering ways to promote physician well-being in the workplace.
A wonderful take. Thank you for sharing that with us.
Mr. Dew, over the last 15 years, I have noticed a level of unrest and almost overt disgust among colleagues with the electronic health records. And some say that's the biggest deterrent to their practice of medicine. And perhaps to joy in practice. What's your perspective on the EHR in all of this?
For sure. So what I can speak to is from my review of the literature, especially with concerning joint practice and other measures of physician well-being. So I know that EHR usage has been strongly linked to contributing to burnout and lower physician satisfaction, according to many studies in the past. One study that I found that was interesting was limiting the burden of the EHR on physicians, such as introducing scribes into the clinic, reduce burnout and improve physician satisfaction in that setting. I think it is an interesting question for sure when one is thinking about how medical technologies impact something as profound as joint practice. We did not look further into EHR usage, unfortunately, in our study. However, from my knowledge, if I were to guess, the electronic health record can often get in the way of providing the best care for patients, as you mentioned. And providing the best care for patients is often the purpose and mission from many physicians in their practice. So for that reason, I would say that if we were to look at that in a future study, EHR usage would negatively contribute to joint practice.
Your findings found and identified a strong association between joy in practice and sense of calling. Many physicians associate calling with faith and religion as motivating factors in their choice to become a physician. Did you and your co-authors discuss this finding? And do you have any thoughts about the notion of a calling as integral to the joy in practice?
Absolutely. Before I dive into that question, I just wanted to mention that many interventions today that have been implemented to combat burnout make many assumptions of how physicians are motivated. Many of these interventions target extrinsic motivators, which include income or workplace conditions, which have been shown to have a strong link with career satisfaction. Now, an important goal that our research is trying to accomplish is to raise awareness of the things that intrinsically motivate physicians, such as I've mentioned before, altruism, self-expression, intellectual challenge, or as we're about to talk about, calling. Now, calling does have its roots in religion and theology, as you mentioned. However, lately it's become a broader concept that refers to a sense of purpose that sustains one's motivations in accomplishing something. So to put it in terms of physician, having a sense of calling means that you have a sense of purpose that nourishes the motivations for practicing medicine. We believe it makes sense that we found that physicians are over 10 times more likely to experience joint practice if they have a strong sense of calling. We believe that calling or having a sense of calling in the practice is integral to enjoying the practice of medicine for two reasons. First, one important aspect of joint practice is fulfillment, which we've used in our joint practice measure. Physicians who practice medicine with a strong sense of calling will more often feel fulfilled from their work. And having a calling by its definition nourishes a proper sense of self-fulfillment. Second, resilience or clinical stamina, which is how we named it in our study, is another component of joint practice, which refers to the ability to maintain one's well-being and sense of purpose during times of stress and adversity. A sense of calling is meant to nourish one's own purpose, especially when one encounters stressors that can lead to burnout. So I do believe that calling is something that should be further explored in literature. There are a few studies that Dr. Yoon has put out that I believe are really interesting that have covered this topic, but there's definitely more room to discover how it's affecting physician well-being and how it can contribute to it.
We were intrigued by your finding that extrinsic factors such as specialty, practice setting, and annual income were not significantly associated with joy in practice in your study. Can you comment on why that might have been the case?
Yeah, I think it is a very interesting finding because most of the literature, as I've mentioned before, has found a strong link between extrinsic motivators and career satisfaction. And what we found is that extrinsic motivators are not associated with other measures of physician wellness, namely joy in practice. In addition, a previous study led by one of my co-authors found that extrinsic motivators are not associated with life satisfaction or life meaning, which are other commonly used physician well-being measures. So one question that I believe arises from this contrast in findings is how should we measure physician well-being? Something such as career satisfaction or burnout or joy in practice. And I believe this is a question that should be explored more and discussed about because it informs how we develop our interventions. How it looks like in practice today is that most interventions target extrinsic motivators of physicians, such as allowing more physician autonomy in the workplace, or raising physician compensation, or minimizing the negative effects of the HR, which we've talked about, which are all important factors in physician well-being. However, our study's findings suggest that fostering intrinsic motivators in physicians may be more effective in contributing to something like joy in practice. This approach will definitely be more challenging and will take more creativity, since it's definitely much easier to modify the work environment compared to fostering and supporting stable physician characteristics, which sometimes needs to be started and done earlier in the training path for someone that is trying to attain these stable physician characteristics, such as having a sense of calling, or learning what it is to be like more, to learn to what it's to be more altruistic, for example.
Over the years, most physicians have tended to view positive relationships with patients as a primary factor in providing joy in practice. Do you believe, based on your study and the literature, that the patient-physician relationship remains a significant factor in the enjoyment of the practice of medicine?
Very much so. I think it is the reason for why many physicians enjoy going to work, because for some, they're looking forward to seeing patients they've seen for many years and have developed a relationship with them. Or for others, the opportunity to meet new people and become involved in their lives in some way. Even now, as a medical student who's about to start their third year of rotations, I'm excited to finally do what I came here to do, which is to start taking care of patients in the hospital after spending 2 years in the classroom. So I believe that the relationships with patients is important for a physician to be able to experience joy in practice. What I find problematic, though, if I can mention, is that the way we're measuring physician well-being right now in the literature, or at least many of the commonly used measures, do not account for how physicians view the act of caring for patients, or the physician attitudes towards patients. For example, there is a single item MASLAC burnout inventory question that many studies use, and that our study actually used, which basically asks physicians how often do they feel burnout, which is an effective and very simple way of assessing burnout and has been used many times before. But when we're talking about how important it is to include the patient-physician relationship, especially when we're talking about joy in practice, I think it is problematic that we're not assessing for physician attitudes towards seeing patients, because it does, in my opinion, have an effect on, or have a reflection on how the patient care and the quality of patient care that's eventually given based on how physicians are seeing patients. For example, our study, the way we assessed physician attitudes towards seeing patients is through this enthusiasm measure, which our question was, how often do you look forward to seeing patients? So I believe asking questions like that when we're assessing physician well-being in the future will be more helpful if we're trying to assess joy in practice in physicians.
Mr. Du, I've been caring for patients as a physician for over 50 years. I've got a son-in-law who's an emergency medicine physician, and another son-in-law who's a pulmonary critical care physician. Neither of them have any interest in practicing that long. And I just wonder, as kind of as a young physician in training, do you see your sense of lifestyle and so forth wrapped up in purpose to practice for 50 years? Or do you think that's a changing concept that's generational?
As we're moving towards, I think there is a generational shift in how we think about our jobs, not just in medicine, but in anything. When it comes to lifestyle and specialty selection, I think, at least from my experience with my medical school cohort and other medical students that I know around the country, a big consideration is lifestyle when it comes to choosing a specialty. And I think that, as I've mentioned before, when I'm considering going into the practice of medicine, burnout is something that is definitely concerning for a lot of us that are thinking about, how long we want to be practicing for, as you've mentioned, 30 years out of training, for example. And seeing statistics on, burnout for many different specialties and how it's disproportionate for some specialties compared to others, I think drives us away from certain specialties. But I think for me, considering a career in internal medicine or possibly primary care, where burnout is definitely a big factor, maybe more of a higher rate than other specialties. And even on top of that, a career in caring for underserved patients, which are generally more complex and require more training and time with these patients. I think what maybe a solution is to think about how are we developing these intrinsic motivators in young physicians, especially physicians in training, and thinking about our callings towards medicine and what initially drove us in the first place. And I think the findings of our study are important in this question, because if we can continue finding that there is a strong link between having a sense of calling and like reducing burnout and it being a protective factor of burnout and fostering resilience, then I think that then we know how to really tackle this problem of young physicians or trainees being steered away from certain specialties that lead to burnout or higher rates of burnout.
Perspective is very important. We appreciate you sharing that.
For sure.
So my final question, Mr. Du, is at the end of your article, you're suggesting some future directions for additional research on this topic of joy in practice. What sort of topics or elements would you like to look at in a future study?
For sure. I think there are many different avenues that this research can go towards in the future. The first being developing a more robust joy in practice measure. The measure that we have is promising, but it is preliminary, and we'll need further psychometric testing, for example. But also, there are different facets of joy in practice that have been associated within the literature that we weren't able to cover. For example, having a sense of gratitude, which I think is an important component of joy in practice, just the feeling of being grateful and letting that be a constant driver for your practice to be able to care for patients is something that we did not include, but we'll hope to include in the future. And the second thing I think is really important is character and moral formation in physicians. Kind of what I was hinting at before, fostering these virtues or intrinsic motivators, like a sense of calling in physicians as they're training. It's something that's received growing attention in fostering resilience and well-being in the literature. And it's an ongoing process from my view of it, which is fostered by just constant practice and reflection and experience, and often requires being surrounded in learning communities where you can find role models and learning from other members of the care team. So I think this is character and moral formation of physicians is an important topic that can be included somehow in a joy in practice measure in the future. Secondly, as a future direction, I think I'd be really curious to see, just as burnout and possibly career satisfaction has been linked before to better clinical outcomes, seeing if joy in practice also has that association. I think that would add a lot more credibility and more impetus to use it as a measure in the future, if we were able to see that it in turn leads to better patient outcomes.
So comforting to me as what I guess I would be called a senior physician, to see individuals like you with such lofty impressions about responsibilities and the importance of the virtues. So I thank you for being you, and for I hope what you will be able to do for the rest of us in your future career.
Thank you, Dr. Holt. I really appreciate your words and for just letting me be here at the podcast and just share about my study and some of my thoughts and from my experience.
On behalf of the Southern Medical Association and the Southern Medical Journal, we appreciate your spending some time with us today, and thank you again for such a wonderful conversation.
As we conclude, do you have any additional thoughts or pearls of wisdom you would like to share with the listeners?
Yeah, again, I'm humbled to be here as a medical trainee, and just I guess from what I've learned from this study, maybe just to mention one thing that we mentioned in our study at the end, which was to propose one possible intervention that might help contribute to something like joint practice, which is just more opportunities for physicians to reflect within their practice, whether it be in an individual level or within a group such as with your care team or other colleagues like physicians too. I think it is important to have time as a regular time to reaffirm physicians calling for their care of the sick, and to be able to reflect and process certain patient encounters that they might have had, whether they be joyful encounters or maybe sadder ones, and be able to do it with other physicians who are also going through the same thing, and being able to comfort and counsel one another. I think one quote that I think summarizes the need for this comes from Dr. Rachel Remen, a pioneer of the term joy in medicine, from my view. And she wrote, "We remember what we have come to do, but forget why we have come." And I think that an opportunity to reflect will help with physicians who are just going through it every day and just trying to, survive in the clinic, but maybe through reflection, and it will be a bit more enjoyable for them, and to remember why they have come in the first place.
We hope you enjoyed the practice of medicine. For more episodes in this series or SMA's The Business of Medicine podcast, go to sma.org/podcasts or subscribe to us on iTunes, Google, Spotify, or wherever you get your podcasts. For more information about SMA's mission, please visit sma.org. And thank you for joining us.